85% of this infertility is coming actually from infections, whether from sexual transmitted diseases, whether from female genital mutilation, whether from unsafe abortion or unsafe delivery.
See, when we designed our Africa strategy at Merck in 2012, we started. So we said, look, we really have to go to Africa. We have been here before, of course, in Northern Africa, we have been in Southern Africa, but in West and East Africa we haven't been. So we said, we have to go there. Of course, we are a commercial company, that's not a secret, but on the other hand, because we've got the financial means, we can do a lot of things. So it's one stone after the other. There was a capacity advancement program, and of course, and now Merck more than a mother program. There's many more will follow. It's about cancer, it's about diabetes, it's about infertility. And to do this, we have to work, what I said before, closely together with the governments. Yeah? But at the end of it, all we can do is teach, to give advice to women, to teach, to try to overcome culture. And I tell you what, to change in culture is a harder thing to do. It takes a lot of effort from all. It has to come from top down, but it has to come from the bottom as well.
And then empowering infertile women, empowering them, so improving access to information, awareness and education, and change of mindset, and empowering the infertile women who cannot have children anymore because of any untreated causes, to have their independent life by giving them a small investment to establish their small businesses so they can build their own independent and happy life. So this, I think, is a full-fledged campaign, will actually target all the multi-factor of infertility in Africa.
When a child is born, we celebrate. The child goes on to school, we celebrate. The child gets married, we celebrate. After that celebration of the marriage, the mothers are waiting for their grandkids. The pressure starts on the family. The pressure comes from the mothers, us. It is now time that we change our minds and change our attitudes as we look at cultural norms and traditions. Culture and traditions can be modified. They can be changed. A woman's right, like Hillary Clinton said, is a human rights issue.
Like lack of information, lack of knowledge is something that's really making people suffer, making women suffer. Women are the ones who carry all the embarrassment, they carry the shame, they cry tears at night. And sometimes they're not the ones who are carrying that problem. It is a shared responsibility. I want to thank Merck because through this initiative, it has opened up conversation. It has opened up, talking amongst the men. Men are coming out also to talk about their problems. And one by one, we're seeing them accompanying their spouses to the clinic so that they know that it's not just a woman's problem, but also a man has that problem too. And we're happy because now, just 1 week ago, we passed we changed from IVF pill to assisted reproductive technology, so that now we can cover all the other methods that are available, not just IVF. So already we passed that bill at the National Assembly, and it is the first bill actually in Kenya. Maybe in Africa, I'm not sure about other countries. In Africa, it is the first bill in Africa. And right now it has been taken to Senate, and after Senate it will come back to the National Assembly, so that after that the President now can sign it into law. So it is the biggest achievement that we have achieved as women parliamentarians in Kenya.
A parliamentarian attracts a lot of publicity whenever he or she is introducing a bill. And I believe introducing this ART bill will definitely attract the publicity that this initiative needs. And I'm already trying to prepare how to introduce this bill in Nigeria.
First and foremost, I want to thank Merck for speaking on a subject that is known by everybody, but not talked about. So I want to thank Mark for breaking the silence on infertility. Because we all know that oftentimes in our own settings, in our own homes, when a woman fails to give birth, then she's the one who is blamed and not the man. So this campaign is going to help us to bring out the facts and say that infertility is a shared responsibility between the men and the women. In my country, in Uganda, between 10 to 15% of the couples that want to have a child annually fail to have children. So infertility is a problem that we all recognize, and of course, as said by Dr. Rashad, it can actually be prevented.
We have a center, which is, we call it our Center of Excellence, in one of the public hospitals. We provide health services relating to IVF, relating to sperm cleaning and sperm washing and all of that. And I think we've seen a couple of thousands of couples who've come through the program as couples because they're HIV positive who have been assisted through that. And I think we talk about 6,300 or so who come through the program. About 695 of them have been helped because some today they have children and they're really happy. So we believe that the work that we are doing in one public hospital, because of the cost, it is transforming people's lives, and we want to extend those services to the rest of the population.
Most people have said a lot about the difference. But what is unique from my over 40 years experience in infertility is very simple. There is no sin greater than ignorance. That was the famous quotation. And the problem of infertility in Africa is almost 70% ignorance. Because when you discuss with the patient, you see this coming through. If they had known. And so, we must all thank Merck for rolling this process out to bridge the gap of ignorance.
In Latin America, in my country, Mexico, we have this problem, and it's exactly copy-paste in all over the world, I have to say. It's only about education, as Mandela said. Education, 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 education. This is the key point for us.
We need to give information because all the women, we come from constituencies. We are voted by the electorate. If we can let them know the information through education, through information, through pushing the campaign not at the city, but the campaign at the constituency level, so that women know the options available, women know where they can access the treatment, and women know how they can access that treatment. It's very important, and also ensuring
the inability of a woman to become pregnant is a recipe for shame, ridicule, stigma, discrimination, and ostracization. The consequences are denial, access to family traditions and property, divorce, physical and psychological violence.
It is in recognition of that Merck, who is a leader in innovation and sharing knowledge, picked up this gap and said, in discussion with African Fertility Society, that we must do something about training of the embryologist. And that has started in Indonesia 4 weeks ago, and that course is running for 3 months.
El gobierno está implementando un proyecto.
The government are actually implementing a project
lo que con el convenio que se puede firmar con Merck,
an MOU that we can sign with Merck
a través de la Universidad de Augustine,
through the University Agostino,
en particular la Facultad de Medicina, donde soy decano,
particularly of the medicine faculty where he is a teacher,
podemos educar a la población,
so we can educate our people,
hombres y mujeres en general,
men and women in general,
para tener una conciencia más humana al respecto de la situación de la fertilidad.
to have a better understanding about the infertility.
Em Moçambique, a maioria dos casos de infertilidade é imputada à mulher.
In Mozambique, the majority of the cases of infertility are women are the one who is guilty.
E nunca ao homem, como se este nunca pudesse ser infértil.
And men never accept to have infertility.
A masculinidade do homem não permite que lhe seja admitido ser infértil.
Masculinity of men didn't allow them to recognize that they have infertility problems.
Pour ce qui touche la fertilité en Côte d'Ivoire, les statistiques n'existent pas. En raison de la gêne du caractère secret et confidentiel, les femmes peuvent divulguer leur maladie et le caractère stigmatisé. Si bien que les prises en charge ne sont possibles qu'à travers d'autres maladies, c'est-à-dire les maladies qui suivent les violences liées au genre.
Since this is the first time, and I've already said, actually I congratulate the Merck for breaking the silence, and I would like, or rather love to see you in Tanzania launching the same campaign so that we join your campaign. Thank you very much, and welcome to Tanzania.